My name is Katherine Gergen, Barnett. We know that people in typically underrepresented communities, BIPOC communities, we know that they have had historical years of being mistreated by the medical system and frankly mistreated by our country. We know that current day healthcare policy and politics continue to put BIPOC communities on the edge and not being able to access medical care, not being able to afford medical care, and not being able to afford all the things that are critical for health. We need to address housing and food and employment and thinking about the ways that racism in our country has impacted their lives. We all went into healthcare in some way because we wanted to help another person. Nobody chooses to be sick. Everybody needs to come see a provider. How do we create a system where people not only feel welcomed, but heard? We need to train ourselves. We need to be doing our own reading, our own research. We need to do our own self-analysis. There are many examples of relationships I've had that have been building on trust, and there are also examples where I've built trust and lost it in a second. How do we, as physicians, get outside of the healthcare system and look what's happening in communities? How do we recognize the role of churches and community centers in creating wellness for our patients? And how do we augment that? I know as a white woman, when I walk into a room, I'm presenting as a white physician. What does that mean? How do I account for that?